Hello class, today we are going to be starting our unit on congenital heart defects. Before we begin learning about the specific congenital heart defects, I want to go over the congenital heart disease screening that is done. Let's start with talking about what are congenital heart defects. If you remember from anatomy, the heart is formed by 21 days post-conception. Congenital heart defects happen when the heart forms incorrectly in utero. So, congenital heart defects are defects that are present at birth. Critical congenital heart defects are those that require surgery or other procedures in the first year of life, such as a cardiac catheterization. Many states, including New York, are screening all babies for critical congenital heart defects before discharge from the hospital. And all heart defects affect how the blood flows through the heart. So, why do we screen for congenital heart defects? 1 in 4 babies born with a congenital heart defect will have a critical congenital heart defect. So that's about 7,200 babies born in the United States. And the thing is that some of these babies appear healthy at birth and are sent home. And when that happens, that puts those babies at risk for serious complications and even death. So how do we screen for congenital heart defects? Usually critical congenital heart defects lead to low oxygen levels in the blood, and we can test for this using a pulse oximeter. You can see in this photo that the baby has the pulse oximeter attached to the foot. We check the pulse on the lower extremity, the foot, and the right hand to get the pre- and post-ductal saturations. Some critical congenital heart defects cause differences in the saturations, and that's why we do the uppers and the lowers. The test should be done around 24 hours of life and before the baby is discharged home. A complete history and exam should also be done because symptoms can also indicate a critical congenital heart defect, for example, a murmur. The baby will either pass the test if their oxygen levels are normal or fail if their oxygen levels are low. There can also be a difference between the upper and lower saturations. And if the baby fails, more testing is indicated. Usually an echocardiogram, which is an ultrasound of the heart, would be done. What are the symptoms of congenital heart defects? So I've listed the symptoms here. We have problems breathing, heart murmur, weak pulse, pallor or cyanosis, which is the baby being blue, poor feeding. A lot of these babies do not feed well because they get tired out, and lethargy, which also contributes to poor feeding. And here I've shown you a diagram of a normal heart so that you can kind of get an idea of what the normal blood flow looks like. And then this heart over here on the right is a heart that has tetralogy of Fallot, or TET for short. And you can see that this heart looks a little bit different than the heart on the left. There are 4 differences between these two hearts. One, you can see right here we have a ventricle septal defect, which is causing mixing of the unoxygenated and the oxygenated blood. The aortic valve here is also enlarged. There's a narrowing in the pulmonary artery, which is the blood that is flowing to the lungs to be oxygenated. And we also have ventricular hypertrophy, which is the thickening of this ventricular wall down here. So you can see from the diagram that the heart of the baby with the congenital heart defect is a little bit different, and that contributes to the symptoms. So the types of critical congenital heart disease that are detected through testing are coarctation of the aorta, transposition of the great vessels, hypoplastic left heart syndrome, pulmonary atresia, total anomalous pulmonary venous return, or TAPVR, tetralogy of Fallot, also called TET, tricuspid atresia, and truncus arteriosus. Survival rates for children has improved dramatically over the last half of the 20th century and into the 21st century if the defects are detected. Congenital heart disease screening saves lives, so we need to make sure that every baby is screened before discharge from the hospital.